The Minister of Long-Term Care made a stop in Hamilton today to announce new and upgraded beds for residents in this city. But there was no official start or completion date provided. The announcement comes as some of the long-term care COVID-19 restrictions were eased in Ontario today. Nicole Martin reports.
After more than a month of strict rules within long-term care, residents with 3 doses of a vaccine can start taking social day trips, and all residents can see more caregivers. Then 2 weeks from today, general visits with people 5 years of age or older with at least 2 doses of a COVID-19 vaccine will resume. While the move is a welcome one for long-term care advocate Vivian Stamatopoulos,
the families have been asking for this, so this is long overdue.
She says isolation continues to be an issue for homes in outbreak.
Residents are confined to their rooms, they're eating alone, often showers are restricted, sometimes they can't even walk up and down the halls.
The ministry telling CHCH News that local public health units determine isolation requirements.
New guidance from the ministry does allow for a little more flexibility with respect to isolation periods and using testing to sort of shorten that duration up. So I think that we're seeing a bit of reprieve now, but I would say through December and into January, that was certainly a challenge we were experiencing with ongoing exposure.
While cases and outbreaks continue, there are more than 38,000 Ontarians still looking for a spot in a long-term care home. Minister Paul Calandra has spent the past 2 weeks announcing future beds to help alleviate the backlog.
When construction on these homes is completed, 747 residents will have a new place to call home, near their family and friends in communities that they helped build.
5 homes that are slated to see the new and upgraded spaces: Dundurn Place, Parkview Nursing Center, Pine Villa, St. Peter's Residence Shadoke, and Hamilton Continuing Care. The province says a total of 173 new and 574 upgraded beds will be available throughout the city, but it's unclear when this will happen.
We want to have these shovels in the ground as soon as possible.
When it comes to additional staff caring for these future beds,
we're hiring an additional 27,000 healthcare workers for our residents.
What they're not openly addressing, which is the elephant in the room that everyone knows, is that we have an outstanding and flagrant revolving door in this sector.
The new beds announced are part of the Ford government's plan to build 30,000 by 2028. Nicole Martin, CHCH News.